DMH NewsLink, your trusted source for the latest in healthcare news.
DMH NewsLink.
Welcome to DMH NewsLink. I'm Michaela Hunt, and we're fortunate to be joined by Dave Overlop, the Executive Director of Radiology here at DMH today. Dave, thanks for taking some time to spend with us today.
Thank you.
So, some really interesting data that we want to talk about right off the top. Young women and lung cancer. We're seeing more of an occurrence of lung cancer in young women. Why is that?
Well, lung cancer is the deadliest cancer in the United States for both men and women today. What they find out, it actually is declining for both men and women, but what's interesting is declining at a faster rate for men than it is for women. And researchers really aren't sure why.
Could genetics have something to do with it?
It's possible. They're still studying it. They think that women may be a little bit more susceptible to the genes that mutate and cause lung cancer.
What are some of the symptoms that young women or anybody might see if they have lung cancer?
So symptoms can be a persistent cough, coughing up of sputum or coughing up of blood, chest pain, especially like as you take in a deep breath, you get a deeper pain. Just overall shortness of breath and tiredness.
I feel like young women might look at those symptoms and think it's something else, though.
Yeah, they're basically general symptoms. I mean, you have that with allergies and just a minor cold.
So this seems like an obvious question, but for young women, is this related to smoking?
Absolutely. 80% of the people who have lung cancer, it is related to smoking. But there are a 20% population out there who don't smoke that still get lung cancer. And what they're finding out in that situation, that the majority of those are women.
So Dave, tell me, what does prognosis and treatment look like in these situations?
So the prognosis can be very good in that situation, especially if you find it early.
Got it. And this is a snapshot of a screening that you all do here that's all about finding it early.
Yes, so Decatur Memorial Hospital is actually a fully accredited lung cancer screening program by the American College of Radiology. We have an excellent program. We have 2 lung navigators that actually will meet the patient, take them through the process. It's actually a 5-minute CT scan, and once that CT scan is completed, they bring you back to a consulting room where you meet with the radiologist who will interpret your films. And then they look at you and let you know right then what your findings are and whether or not you come back for an annual screening or if you need to follow up for 6 months.
So it's immediate.
It's immediate.
Now, are people getting this done, is my question.
So, the sad part is that only 5% of the population today have actually taken advantage of lung cancer screening. So out of all the eligible people that are out there, I think a lot of people don't want to have it done because of that fear factor. I think they're afraid, they might find something and they're not sure. What people need to know is, it's a study that's done when you're asymptomatic. And so since you do that, when you come in, we only find about 3 patients out of 1,000 screened actually have, potential lung cancer.
So get the screening done. If anything, our message to those of you who are watching today, that sounds like what it needs to be.
Oh, get it done. It can save your life.
Okay. Well, Dave, thank you so much. And for more information on this, just go to dmhcares.com/news.